Well, good evening, everyone, and welcome to our LifeWave introductory call, where we give a short overview and summary of this very special company. We share a little bit about the technology, and then we bring on one of our special guests. Tonight, we have Dr. Stuart Freedenfeld to share some of his wisdom with you. Typically, we open up for Q&A at the end, but tonight we're going to do something a little different, and we're going to get to know a little up close and personal with Dr. Stuart, and that'll be available for everyone. So what we like to start out with is having my partner, Gregory, do a little introduction for all of us. So over to you, Gregory.
Great, thanks, Robin. Okay, well, good evening, everyone. And I'm going to go ahead and share my screen. And okay, you should be seeing LifeWave X39 activates our stem cells. So
Not yet.
Okay, hold on a second. Okay. There, we got it now, right?
Yes.
Okay, good. So let's go ahead and get started. And I want to start by sharing a kind of a wake-up call I had a number of years ago, because I finally figured out what I want to be when I get older, and I'm pushing 70. I'm 69 now. I want to be younger. And so let me ask you a personal question before we get started. If anything were possible, what's one thing you choose to experience differently in your health? And what difference would that make for you? Think about it. What is one thing that you choose to experience differently in your health? Well, with that being said, let me make a note that our products are not designed or intended to heal, treat, or diagnose any disease. However, they do help our bodies get back into a more healthy, regenerative mode, and many times wonderful things begin to happen. So let's go ahead and get started and talk about the stem cell revolution, because we believe everyone wants to look, feel, perform, and live younger. And certainly stem cells are the key because they're a vital part of our immune system that repairs and regenerates damaged cells. Now, the problem is the older we get, the less stem cells we have. And by age 60, only a small percentage remain. And sadly, the fewer stem cells we have, the faster we age and the slower we heal. So what about stem cell injections? Because they've become quite popular, but you know what? They're quite expensive. They can be painful, risky, and controversial. And you know what? No matter how much you spend, there's no guaranteed results. But we've got some really good news tonight that we're going to share with you, because you can look, feel, perform, and live younger with this historic breakthrough in stem cell activation. It's a new wearable technology in patch form. It's affordable, it's safe, it's non-invasive, it's drug-free. It's a patented form of phototherapy that uses specific frequencies of light to increase and improve cellular activity. Now, this is the brainchild of our visionary founder and CEO, David Schmidt. And David is not only a brilliant scientist and researcher, he's also a genius inventor with over 100 patents and patent pendings. And he's been on the leading edge of phototherapy research and science for over 20 years. And David's already conducted over 90 clinical studies, some of them double-blind, placebo-controlled clinical studies, proving the efficacy of LifeWave phototherapy products. And many more studies are currently in the works. Now, LifeWave is a 17-year-old advanced technology company. It was started back in 2004 based on an energy-enhancing technology that David developed under a government contract for Navy SEALs to help them increase their strength, stamina, and performance without the use of drugs, stimulants, or caffeine. And this technology, this product turned out to be so effective, it's now used by world-class athletes all around the world in almost every sport. We have corporate headquarters, laboratory manufacturing in California, Utah, and Ireland. And we have global distribution to over 75 countries from our 14 global distribution centers. Now, certainly the word is getting out, and LifeWave patches are now used by pro and amateur athletes around the world in almost every sport. And the media has begun to notice, and you might too, if you look carefully at some of your favorite sports teams and games, and maybe even looking back at the recent Olympics and see these auspicious little patches on these athletes' bodies. So how does this amazing technology work? Well, it's based on a type of light therapy called photobiomodulation. And what that means is LifeWave patches contain very specific combinations of organic materials and nanocrystals. And when they are applied or near our body, they're actually activated by our body's own infrared heat. And then the patches then begin to re-emit very specific wavelengths of light that stimulate targeted and beneficial biochemical responses in the body. And this is known as photobiomodulation, and it is the basis of our LifeWave phototherapy patches. Now, it's been a well-recognized and proven scientific principle that specific frequencies of light can cause very specific changes within the body. For example, when we go out in the sun, a specific frequency of light causes our body to make vitamin D. We're not getting a download of vitamin D from the sun, but we're getting a download of light frequency that triggers our body to make it. And likewise, another frequency of light, UV, causes our body to make melanin, the chemical that gives us a suntan. Well, I'm happy to say that LifeWave's patent technology is based on this same rock solid, well-recognized scientific principle. And for the last 12 years, our focus has been in the area of anti-aging and regenerative science. And in January, 3 years ago, in 2019, we released to the global market the LifeWave X39 stem cell activation patch, which is really the crowning rose of David Schmidt's career thus far. And X39 is a historic and affordable breakthrough in stem cell activation. Some are actually calling it the holy grail of anti-aging restorative science because we're doing what the multi-billion-dollar companies in big pharma have not been able to do. And X39 actually activates a very specific copper peptide that activates our body's own stem cells and at the same time alters gene expression towards a younger and more vibrant you. So X39 certainly is a game changer. It's a true breakthrough. And David Schmidt, our founder, inventor, and CEO, says this is my greatest achievement yet. So yes, we have patents. Yes, we have clinical studies. Yes, we have field results proving that X39 is actually turning back our biological clock, helping people to look, feel, perform, and live younger. And for us baby boomers, this is very exciting information. So Robin, that's my quick summary. I'll turn it back over to you and to introduce our special guest doctor tonight.
Oh, thank you, Gregory. That was wonderful. And our doctor is an embodiment of what you were talking about. So I'm very excited to introduce this evening Dr. Stuart Freedenfeld. And I want to read a little bit about his bio because I want to make sure I get it right. He got his medical degree with honors from the College of Medicine and Dentistry of New Jersey in 1975. He was in family practice. He was a chief resident at the Hunter Medical Center, the family practice. And he was recertified many, many times, 84, 90, 96, 202, 2002, 2008. And then he served as a clinical instructor at the Delaware Valley Family Health Center. Then he went on to become an instructor at Rutgers Medical Center. This is a man who loves to instruct, to share his wisdom and his knowledge, and he loves those challenging cases. So we're going to hear a little bit more from him in a few minutes. And he practiced medicine and surgery in New Jersey and Pennsylvania. Then in 1988, something changed in his life, and we're going to learn about that this evening. You know, what is it that actually inspired him to open up to learn about other modalities of healing, and then to choose, you know, whether it's herbal medicine, homeopathy, functional medicine, what is the proper combination of things to work with people that have complex health issues. And so he's now recognized as one of the leading experts on the integration in different forms of healing. So I'm thrilled to share with you and bring on this evening Dr. Stuart Freedenfeld.
Howdy.
There he is. As one of my favorite soccer players.
Name two others.
Name two others. Oh, I my college friends. You don't know them. You don't know them, but you know, number one in this law school at Harvard, actually. Yeah, so you guys are in the same territory over there. But let's jump in. I always like to start out by asking Dr. Stuart, what is it that actually attracted you to be interested in even looking at LifeWave?
Oh, a colleague. a dear friend that I met on the lecture circuit. And she's, we learn who we can respect and who's a lot of blutter. And she's someone who I respect. And she had found these patches and said she really wanted me to try them. Just thought they were really miraculous in her life. And I kind of begrudgingly said, yeah, all right, who could believe that kind of nonsense? And I tried them, and I just had remarkable results. Initially with localized pain, and being a dedicated athlete, I have dedicated pain. And I mean, it's kind of strange when your pain goes away in 5-10 minutes. So that was kind of cool. But more importantly, when you're 73 and playing soccer with 20-year-olds, you have trouble with stamina and recovery after games, and that's just been dramatically better for me.
How exciting!
It's lovely. It's just really sweet.
And your beloved also had some pretty wonderful results, didn't she?
Patricia has had a chronic neuropathy in her foot. That's a painful foot disorder. It's a burning pain that she gets when she tries to walk. And being integrative medicine, we tried loads of things, and I sent it to colleagues, and people tried everything, and nothing. Things would work for a few weeks and then not. And it's really inhibited her life. She couldn't hike and do the stuff that she always loved to do. And within 4 or 5 months of X39, she's back saying, she's got 70% better in her feet. And in wintertime, it's always the worst for her. And we're taking long hikes, and it's not a problem. And that's great. She had a shoulder problem too, that she had from a whitewater rafting accident. And she was getting ready to go to surgery. And we started patching her with X39 and Eon and glutathione, and she's back playing tennis now, and doesn't complain about her shoulder anymore. She's forgiven me for taking her on the Class 5 whitewater rafting trip.
I don't know if I would, but I'm glad she has.
I don't know if she really, really could forgive me, but at least we don't talk about it.
It's good to have a doctor on the trip. I'm one of those.
Maybe.
No, thank you. But I'm glad you enjoyed it. So let's transition into stem cells for a minute, because the term stem cells is very familiar because the media has done quite a blitz on it all over. Some people understand it, some people don't. Why is it so valuable that this product X39 activates our own younger stem cells? What's the great gift in that for people?
Well, stem cells are the source of healing. That's we have this concept that if you tear a muscle, the muscle cells divide and become new muscles. That's not true. We have stem cells that mature into a muscle cell and replace it. Our whole skin is replaced every 7 days from stem cells at the basal layers that mature and grow outward until they become these squamous, flat things that fall off and become dust in your house. People know that most of your dust in your house is skin cells. Truth. Our GI tract is replaced every 7 days. So stem cells are a source of healing. In fact, our whole body develops from stem cells. We've talked about this before. We start as a fertilized egg, which is a embryonic stem cell. It is the beginning. There's this pluripotential cell that has the ability to alter its nature and become a different type of cell, become a different line. Some of them become placenta, some of them become baby, and those baby parts are just skin and muscle and eyes. And so these are all different lines of stem cells. Well, if we lose the ability to make stem cells, we lose the ability to heal as we get older. That's one of the aging processes. So what a remarkable ability if we could now have stem cells that repair, and they keep us going as they were when we were more youthful, when our bodies were more vigorous, to keep repairing those tissues. So we don't get that chronic degenerative change upon degenerative change, and till we, gradually become sicker and sicker and older. Gregory said he wants to die. What he doesn't want to do is when he wants to get older, he wants to get younger. And not true. We want to get older. We spend a lot of time and effort getting older. We take supplements, we eat well, we exercise because we want to get older. We want to stay youthful and vigorous. So stem cells is one of those aspects that keep us able to be vigorous. And some of the other patches do other things that keep us vigorous. Improve our energy supply chain and improve our detoxification capabilities. It's kind of a neat technology and a neat aspect to be able to offer this to our own body.
It's so exciting. You said it so beautifully. They're how our body heals. And Gregory said, like, the older we get, the faster we age, the slower we heal, because we have less active, vibrant stem cells. They get older and not as effective as they get older. So the fact that we can do that. So this patch, this technology, the X39, who should be using it and who shouldn't?
Let's see. People who want to stay youthful and vigorous should use it. People who want to get old and decrepit should not.
You got it. You got it. That's great. So it's really for everyone. And we do mention that if someone is on an immune suppressant med because they've had a, transplant, that it does support the immune system. So we don't want to get in the way of that. But really it's for everybody, which is very exciting. And it's called non-transdermal. What does that mean?
So transdermal means goes through the skin. So if you put a transdermal nitroglycerin patch on, the nitroglycerin leaves the patch, goes through the skin into the body, and we get an effect from the chemical. So these patches are not releasing any chemical. There's nothing that goes through the skin other than light waves.
Exciting.
So light waves are transmitted through the skin and stimulating what's called signaling molecules that turn on biologic processes.
Which is so exciting, which means it's safe for people because there's no contraindications. Nothing's going in the body. And that's why you saw all those athletes that Gregory showed earlier that are using this, because the Olympic Committee tested this. At first they thought, oh my gosh, these guys are doping. The US swim team, 6 of their 8 swimmers did their personal best the first time they used one of the patches. So all this testing happened. So let's take it just the next step. How do we get the maximum benefit from utilizing this technology, Dr. Stuart?
Okay, so anything depends on everything else. Our body is not dirty clothes that you take to the laundromat. We need to take care of our body. So if you want to get the best out of patches or anything else, you maintain everything else. You exercise, you eat healthy, you don't carry unhealthy thoughts, forgiveness and generosity and contentment, adequate hydration, good quality supplements where necessary. You want to do the whole thing. You want to eat organic food as much as possible. You want to eat food that hasn't been poisoned. I mean, if you're putting pesticides on a food, it's poisoning. I don't know what else you want to call it. So okay. you want to eat healthy.
Yeah. Well, thank you, because I love that David Schmidt, our founder, says the same thing. The patches do amazing things, but we've got to do our part. It's all part of a whole. And so we want to do our part. Now, how long would it take for someone to notice the benefit of X39?
That's been variable. I noticed it right away. One thing that happened with Patricia early on, she has gone to the gym and worked out and really tried to get her stamina, but she's stuck. We get on a bike and she goes for a bike ride and she gets to a 4-mile mark and she needs to get off the bike and sit for a little bit. Been for years. 3 days after the X39, we went for a bike ride, and we're riding past her usual 4-mile bench, and she didn't want to stop, so we kept going. We got to the town upriver, which is 8 miles away, and we were going to stop and have lunch. and then got on the bike, come back home. And she said, it's too crowded. It's COVID. I don't want to get off the bike. Let's turn around and go back. So she did 16 miles without stopping. It's like, who is this person?
It's so fun, isn't it?
But by and large, most people, and the majority of people that I've shared this technology with have not had that kind of a dramatic response. It's more of things are better. It's been a month, it's been 2 months. Things are better. I can see that. I have a reason for keep going, but not many people get that wonderful dramatic effect that I fortunately had.
Yeah, and thank you for saying that. I tend to be conservative on expectations because how our bodies are is not the way it took time to get to those challenged or limitations. And so it may take time for it to turn around too. So for some people, it's wonderful if they have like this instant experience like you did, but it doesn't happen all the time. So it could be hours, days, weeks, even months for people. And as long as we know that the patch is always working, the technology is working, and stem cells are like wise. They know right where to go, don't they?
Yeah, but you may not know where they should go.
Well, we know where we want them to go, but that's not necessarily where they're gonna go. Because when I started,
elbow hurts, yeah, but your kidney damaged.
Yeah, your kidney is more important than your elbow, and that's the beauty of stem cells. They have this wisdom to know what's most life-threatening if we need to, repair, regenerate some damaged cells. So, any other final comments before we get into talking a little bit more about you, about LifeWave, the patches, the technology?
The other mention about getting the best out of them is the on off. Wear it for 12 hours, let your body rest. And I like to think about it like if you had a bow and you put an arrow into it, you can't pull that string back for 12 hours, 14 hours, 3 days, and expect the arrow to fly again. You need to let the body recoil. You let it recharge and get ready to respond once again. So you put it on, wear it for 12 hours, take it off. 12 to 15 hours. I over.
Beautiful. It's not an exact 12 hours on, 12 hours off, but what I'm hearing you say is the body does need a break to have the signal be most effective. Thank you so much for mentioning that one. And hydration, the patches operate on our body's electrical system, and it needs to be hydrated to work well, like everything else in our body, right? Yeah. Do you notice that most people are dehydrated?
I don't know. I think we've kind of overstated the amount of water that we need. Being a camel by nature, I'm very, very scant drinker. But I think overall we've overstated that. I think that people need to obviously drink to thirst, and you want to drink enough to have relatively clear colored urine. If you don't have enough fluids, your kidneys will take the water back, and the remaining discharge is darker because just having this more, it's less dilute. So if you see that your urine is kind of clear, very pale color, you're getting adequate hydration.
Thank you for that, because that's one of the easiest ways for people to know if they're getting enough fluids. And alcohol and caffeine actually dehydrates, so you need a little extra, but the color of the urine, if it's dark, then you need more water. So
except if you're taking a B complex.
Oh yeah. Oh, some of those vitamins turn the urine interesting colors. Yes.
Right. Riboflavin has a bright yellow color to it and a nasty smell.
Yeah. We're not going there. So we want to do our part, which is taking really good care of this vessel, whether it's sleep, nutrition, rest, hydration, good food in, good food out. Food is medicine or food is poison. So we just want to do our part and let the patches enhance that. So are you ready to talk a little bit about you?
Okay,
I'll force you. Because our audience loves to we have really, really wonderful practitioners involved in LifeWave, and they typically love LifeWave for two main reasons. One is, that there's the science to back it up, and two is it works. And so you started out early on going through medical school, going through that whole process of internship and things and becoming an educator. Why did you start? What made you decide that you wanted that career path?
I actually planned to be a scientist. I wanted to do research. And it was in college that I realized that the laboratory was not enough for me. I needed contact with people. So I moved into medicine. And even there, I started off, I was going to be a neurosurgeon. And then I decided I really wanted contact with people. So I specialized in family practice, where we were really in the thinking profession rather than the doing profession.
I love that about you, because you were mentioning earlier that you're fascinated with the complex medical challenges that people have. And so that's what kind of spurred on a lot of your career. And you became an educator, and you've traveled all over the world educating physicians, which is very exciting. And now, well, let's go back to 1988. Something changed in your career back in 1988. So you want to share what inspired that and the direction you went and what happened because of that?
So I was in a rather conventional medical practice. I was a radical individual doing conventional medicine. And there was, in 1 year, I had 3 patients that I had to send for bypass surgery. 3 of the patients that I sent. And one of them had a fatal accident on the catheterization table. The other one died after the stent was placed. And the third one, had a successful stenting, but she had a infection and chronic inflammation in her groin where the catheter is put in to, do the angiogram. That was a year of misery. And at that time, I had heard talk about something called chelation therapy. And I decided, you know what, maybe there is some other way than this approach to medicine, to catheterization and bypass. And I went to a conference, 3 days studying chelation, and the science, the background, the efficacy was crazy, wild, perfect, wonderful. The doctors that were performing it, their skin was beautiful. Their 80-year-old wives, her husbands were just looked great. They were doing chelation. And so that opened up my eyes. But I stayed for the main conference afterwards, which was 3 days of biochemistry science, presented not by doctors who were on salary for the pharmaceutical industry, which most of our conference lectures for conventional doctors, but by the scientists who were doing the research. So the lead researcher of magnesium and coenzyme Q and carnitine were talking about their research. And it was just mind-blowing. It just opened up this thirst for knowledge to go further. And it's been an unquenchable process for the last 45 years. Even now in retirement, I still read and research, and people still come up to me with strange exotic disorders. So okay, let's look at the biochemistry and see what we could do. So that's been fun.
So you got into all kinds of things. What were some of the modalities that you incorporated in your practice with your patients?
Wow.
What were some of your favorite ones?
So, well,
Elation.
there are no favorites, because the favorite is what makes the person whole and healthy. A lot of times when you use pharmaceutical medicine, there is a give and take. The blood pressure gets better, but you feel awful. You're weak and tired, or you get headaches, or your arthritis is better, but your stomach is burning. So when you really heal somebody, which is what integrative natural medicine does, is just supporting the body's natural processes. That's really a joy. It's It's a gift.
That's so beautiful. There's this term that people use called functional medicine. Some people know what that means, some people don't. And you consider yourself a functional doctor, correct?
Yeah, so we're looking at pharmaceutical medicine is basically using a drug, originally a small segment of a plant. Right? Our original pharmaceuticals were drege, comes from drug comes from drege, which is the drying of herbs. So herbs were our initial medicine, but the pharmaceutical industry would take an extract of the herb and say, "Oh, this is the active ingredient, and we'll sell it as a pharmaceutical." When you do that, you lose the balance, the yin yang of nature, and you only get the specific effect, but also specific side effects. So drugs are basically, I don't say poisons, but they block biologic processes. That's how a pharmaceutical works, by and large. Where functional medicine, we say, well, what's the body trying to do? Something simple. If you've got arthritis, I can give you a pain medication that blocks the pain, or it blocks the production of prostaglandins that are causing pain. Well, prostaglandins is how we heal, how the joint heals. So if we do that, we block the healing process. So in functional medicine, we'll do something to support the healing process. Give glucosamine to promote the development of new cartilage.
So it's a form of medicine that honors more of the body and nature's processes of having the whole ingredient, of honoring the biochemistry and working synergistically together instead of just one part.
Well, that was beautiful.
Yeah.
Supporting the function of the body.
Supporting the function of the body. I love it. I love it. I love
knows
it.
what they're trying to do.
Okay. So are you still lecturing at all?
COVID has taken that away.
Oh, darn. Because
Yeah.
I know you love to educate people, and that's so beautiful because you have such a beautiful, diverse background that brings it all together so beautifully for people. And yeah, that has been a challenge for a lot of people. But you're an athlete now, and you mentioned earlier you're on the soccer field with a lot younger people. So what's happened? Because we were talking earlier about this new product we have called X39, and I'd love to hear what you've noticed being an athlete. What have you noticed because of that new product?
My personal stamina. I think more importantly, the recovery time, the pain after a game, the stiffness that might have taken 2 or 3 days of the week to get back to feeling okay again. It's pretty much doesn't happen.
That is one of those things that happens in the aging process, and isn't that wonderful to turn that one around?
It's so funny when I play now, and some 40-year-old guy, says, "Oh, I'm getting too old for this." You get out of my face.
Do you go up to him and say, "Guess how old I am"?
No.
I bet you've inspired a lot of those young ones.
The people who do know what my age is, they honor it. It's nice.
That's great. That's great. So right now you're retired from practice, and you're very active in your life, and you still do work with some people. Anything else you want our audience to know about you? Because we love having you on our Tuesday night calls, and this is a little special treat to do an up close and personal of Dr. Stuart, and we'll be doing that with each one of our doctors. So our audience can decide which doctor might be the right fit for your guest on a call, or anything else you want to share about your background, your wisdom, your passions.
I don't know. I really think that it's important that we don't hype things. It was always a pet peeve when people get on a lecture podium and they talk about something like it's perfect and everybody gets one. I think we need to be much more realistic about that, and not just focus on the one product. You've known that when I've been given questions about LifeWave, I'm not just going to mention a patch. I'm going to talk about a more holistic approach to what's going on with somebody. And if the patch is not the right answer, I'm not going to suggest it is.
Right. Yeah, and that's so beautiful about where you come from with the work that you've done with your patients over the years of integrating which are these modalities that are going to best serve their healing, whatever that may be. And you talked earlier about, it's not just, the physical things, it can be the spiritual, emotional things also that are part of our health. You just want to address that a little bit, because I don't think we talk enough about that. You mentioned something like, you mentioned forgiveness, and what thoughts we have. So you want to just talk about that for a second?
Someone asked me, what would be the most important things you would want your children to know?
Mm-hmm.
And I thought about it, and it's really contentment. We spend so much time, reliving the past and beating ourselves up about it or worrying about the future. And at those times, we're just not enjoying the only thing that we have to enjoy, which is the present. So living in the present moment, and loving what is. Loving what is.
That is beautiful. And if more people would do that, we'd have a much happier world, loving what is and being content with what we have. And we have so much, and we're so blessed. So, Dr. Stuart, what a gift you are to LifeWave, what a gift you are to the world. Thank you for taking the time to be with us today. Anything else you want to say before we close?
Oh, good heavens, we're closing? Can we go all night?
Yeah, well, you want to? Any other final comments?
No, I'm good.
Okay, well, we'll call this complete, and thank you so much for being with us, and thank you each and every one of you for taking the time to be on our call. And for you that are guests, we want to encourage you to get back to the person who invited you. We have a wonderful program as customers. If you just want to try it for yourself, or if you're the kind of person that likes to share, then we have a very lucrative, generous program for members and distributors to compensate you for sharing the great news of LifeWave. So thank you everyone for joining us, and we'll say goodbye. Bye-bye. Thank you, Dr. Stewart.